In the last recording, we discussed the ankle and subtalar joints. Now we'll be talking about the joints of the foot. Let's start with a recap of our bones. First we have our tarsals, then our metatarsals, then our phalanges, which are organized into a proximal row, an intermediate or middle row, and a distal row. The foot joints are basically a reflection of the joints of the hand, but of course it's a far more complex structure because it's adapted to allow a bipedal stance and locomotion. And it's the only part of the body that's in regular contact with the ground. There are 28 separate bones in the human foot and 31 joints, including the ankle joint. So when I say it's complex, I mean it. What most people think of as the foot proper involves the joints of the tarsals, metatarsals, and phalanges. We've already discussed the subtalar joint. The other intertarsal joints, for example the tarso-metatarsal joints and the intermetatarsal joints between them, are relatively small. These joints are tightly bound by ligaments, which allow very little movement. But this is important because they do allow some movement. If the feet were just a couple of solid bones, then every time your foot struck the ground, it would send shock waves right up your leg. So these ligaments basically act as shock absorbers, using that little bit of movement to dissipate these impacts. Additionally, the tarsal and metatarsal bones are arranged in longitudinal and transverse arches. And this increases the tolerance of the foot. These ligament-supported arches also act like springs, propelling the foot forward during walking and running, or in my case, a unique ability to fall upstairs. All this flexibility also allows the foot to deform in response to walking on uneven ground. And of course, this is helped tremendously by the more flexible metatarsophalangeal and interphalangeal joints. The tarso-metatarsal joints have very little movement, as I said, and this is the articulation between the metatarsals and the tarsals. And we can understand where those are if we look with the skin back on, essentially looking at an imaginary line through the midfoot, starting at the little lump here, which is actually the base of the fifth metatarsal on the lateral side, and traveling medially. Metatarsophalangeal joints are condyloid joints. They're basically the joint between the rounded head of the metatarsals and the shallow concavities on the proximal flange, which means there's a wide range of movement that can occur here. Actively, we mostly see extension occurring, much greater than that of flexion, and this is adapted to the needs of walking. If you think about it, when you bend your foot, such as walking on tippy toes, you have a tremendous amount of active extension, but very little flexion. And we can see that if we put our muscles back on and look at our extensor digitorum, we can see where extension is occurring. The interphalangeal joints, like the phalangeal joints of the hand, are almost pure hinge joints, in which the trochlear surfaces on the phalangeal heads just attach to the next phalangeal base. And again here, we have flexion and extension, but differently, it's flexion that is marked or more obvious, and extension is limited by the tension of the flexor muscles. And again, we have a proximal interphalangeal joint, an interphalangeal joint, and a distal interphalangeal joint. And that's the joint.